Canadian singer Justin Bieber's fans are in utter shock after the singing sensation and the pop icon revealed that he suffered facial paralysis because of Ramsay Hunt Syndrome. Take a look at my report.
So his eye is not blinking. I can't smile on this side of my face. This nostril will not move.
A Ramsay Hunt Syndrome that leads to partial facial paralysis. Justin Bieber, only 28 years old, let that sink in.
I'm just physically, obviously not.
The Ramsay Hunt Syndrome is a rare neurological disorder caused by the varicella zoster virus. Occurs when an outbreak impacts the facial nerve. The syndrome can also cause hearing loss. Some of the symptoms of this syndrome is drooping, paralysis and weakness on one side of the face. This has now put focus on a very ignored aspect in all our lives, physical and mental wellness, and the fact that stressors need to be controlled.
Obviously my body's telling me I gotta slow down, and I hope you guys understand.
Ramsay Hunt Syndrome is a painful rash around the ear, on the face or on the mouth. It occurs when the varicella zoster virus infects a nerve in the head. Medical experts believe that stress weakens the immune system and damages the facial nerve, which can cause the facial paralysis. The condition that causes one side of your face to droop or become stiff. While stress is one of the main factors, this condition can also result from Bell's palsy, congenital conditions, trauma, diseases, stroke and many other factors.
So there's full paralysis in this side of my face. So for those who are frustrated by my cancellations of the next shows, I'm just physically, obviously not capable of doing them. This is pretty serious, as you can see.
Apart from Justin, many Hollywood celebrities have battled the facial paralysis. Reportedly Angelina Jolie, George Clooney, Pierce Brosnan and many high-functioning individuals have been diagnosed with it. This serves as a wake-up call for many in highly stressful work environment. Bieber has currently postponed his Justice World Tour due to his illness. This just hours before his first slated concert in Toronto. While he has not revealed a timeline of recovery, the singer revealed that he is taking time out to recover for the moment. In New Delhi with Chaiti Narula for India Today.
I'm being joined by two top doctors to really understand, because this is not just about Justin Bieber. This is about each one of us and waking up to a rude shock. This is a 28-year-old who has woken up to the rude shock that he's suffering from facial paralysis. Imagine being 28 and waking up to something like this. Dr. Sonia Lal Gupta, she's a top neurologist, and Dr. Kiran Sethi, she's a top skin and wellness doctor. Welcome both of you and very good afternoon. Let's begin with Sonia. Sonia, what is the Ramsay Hunt Syndrome? Does that lead to facial paralysis, or can both of them happen together? You know, it's a rude shock being 28 and being diagnosed with something of this nature.
Yeah, hi Chaiti, and thanks for having me. Let's understand what is the Ramsay Hunt Syndrome. In simple terms, it's basically a viral infection of the facial nerve that supplies the muscles of the face. And this virus is the same virus that causes chickenpox, the varicella zoster virus. Now, when people get chickenpox, when they're younger usually, even after the infection is gone, this virus goes and kind of stays dormant, or in simple terms hides in the body and kind of stays deactivated. Now, in certain conditions, like if age is above 60 years or if the immunity is not as strong, this virus can get reactivated and it can affect different nerves in the body. And one of the nerves is the facial nerve. So it basically is herpes zoster, the infection, or shingles, what people commonly know, of the facial nerve. And it starts with a rash, typically in the inner, either it's inside the ear canal or around the ear, sometimes on the face. And it's a very, very painful rash. Along with it, there's facial paralysis that is there because there is swelling or inflammation of the nerve, and the virus has kind of affected the nerve. That's why there's facial paralysis on that same side where you have the rash. So those are the more common symptoms that we see.
Right. So, since you mentioned a rash, I just want to bring in Dr. Kiran Sethi here. Kiran, you must be having so many people walk into your clinic complaining of a rash. How do you know whether it is so severe or it's just a rash that can just go away, a common rash with medication? Because this is a painful rash around the ear and many patients would be confused. What is it? How do you identify what it is and what can be done to prevent this syndrome?
Right. Yeah, that's a great point. So herpes zoster or shingles, a lot of people have heard of shingles. Shingles can actually occur anywhere on the body. It can occur on the face, it can occur on the hips. It occurs along the course of a nerve. So after you've had chickenpox, the virus stays in the nerve and then just shows up randomly when you least want it. It can show up as, first some people feel fever, some people don't. They feel tired right before. Then they start to feel shooting pains in the area. It feels like a nerve pain, shooting pain. And then you start to see some redness, some red bumps, and those turn into vesicles or water-filled blisters. And over the course of 7 days, it gets better. But the good part about zoster is that if we know it's happening, we can actually treat it right away. Within the first 24 to 48 hours, we can reduce the course of the zoster or the shingles infection, and we can make it less severe and have less side effects down the line, because we just don't want that infection to go crazy in the nerve and cause more problems. Now, Ramsay Hunt syndrome is specifically of the facial nerve, although it can also affect the ear nerve. And it can even affect the vagus nerve, but specifically it's really of the facial nerve. Yeah. So that's why you feel that pain, you feel that paralysis, because the facial nerve actually innervates the muscles of the face on one side. And so ideally, if you start to see fever, if you have a fever and then you have blisters all around the ear canal or inside the ear, that's the time you say, hey, I need to go see my doctor, I need to get treated right away. Because the earlier you give antivirals, the faster it goes away and the less severe the symptoms.
And I want to make this show as informative to people as I can. So Sonia, like Kiran mentioned that you can just get a rash and you need to go to a doctor. Can you go to any doctor and that doctor will then decide what it is and refer you either to a dermatologist or eventually to a neurologist like you, because this is a case of then facial paralysis developing. And one more question is, can people with facial paralysis really live a normal life once they recover? Any precaution, especially because Justin, remember, is a performer. So even more a matter of concern.
Right, absolutely. So, yes. So first thing, see, it's most of the people, they typically go to their family doctor or to their family physician when they have a problem. So I think if somebody is getting a rash, now mind you, it's a painful rash. So wake up suddenly with an acute painful ear, your ear is hurting, you're having a lot of pain, and then you're developing this rash, yes, you should go to your doctor. A lot of times the facial paralysis occurs with it, but sometimes it might occur later. And as Dr. Kiran said, it's important to basically diagnose it early and treat it right away. The earlier the antivirals can start, the steroids, medications can start, the chances of it maybe having a shorter course. So we're not curing it completely, but where the course gets shorter and the chances of recovery do increase. That being said, it does take few weeks for the infection to go away. And it can happen to anyone. That's the real part of it. But people, of course, who are more so having a lower immunity, for whatever the reason might be, or usually people above the age of 60 are more prone to it. Of course, pregnant women, wherever the immunity is a little bit lower, the chances are always higher. And I think that is the key.
And how much time? What is the timeline, Dr. Sonia, for recovery from something of this nature?
On an average, at least a few weeks. So we're looking at 3 to 4 weeks for that recovery to happen. The medications typically continue for 10 days, and after that, you have to give it time. In terms of facial nerve paralysis, sometimes, facial exercises and all should be done. I think it should ideally be done under the supervision of a physiotherapist that can help the face recover. Because the important thing we have to understand is this is a full paralysis. In a way, your whole one side of the face. So people will have difficulty puffing their mouth, closing their eyelid, even raising their eyebrows, their forehead. So that's the paralysis. So the exercises will help get that back over time. And the biggest risk over here is actually the eye. It doesn't close properly. So it's very important that the eye, especially when somebody's sleeping, that the eye is covered, appropriately, so that doesn't get dry and cause further complications.
In fact, you mentioned a very pertinent point there, and if I could ask the producers to even pull out that clip where Justin goes on to say, look at my eye, it is not blinking. Yeah. He shows it to the viewers as well as to how his eye is not blinking. And about the facial exercises, he mentioned in his video that he's going through facial exercises as well. We're hoping he's taking due medication to correct it too. Dr. Kiran, so now once you're diagnosed with this Ramsay Hunt Syndrome, you get these painful rashes, and like Sonia said, that it takes about 3 to 4 weeks for complete recovery from facial paralysis. But then the other part comes. Celebrities, people in public light, people who are performers, Hollywood A-listers. How do they, one, recover from all the scarring? What is the role of stress or probably high performance anxiety in getting something of this nature? Can that lead to this in many cases? Because many Hollywood A-listers have had facial paralysis. We mentioned that as well. Is there a link to high levels of stress?
Yes, so stress will worsen. Stress, as we know, reduces immunity, right? Stress is a well-known cause of shingles or zoster and a well-known trigger. So if you're under high stress, yes, it is more likely. Of course, there are different types of facial paralysis, not just Ramsay Hunt syndrome. There's Bell's palsy, which Dr. Sonia, I'm sure, will discuss, which is different. But it is treatable. It does improve most of the time. The rash goes away. We can treat it with, some people get scars, most people don't, as long as you treat it early enough. It's not anything, the rash at least is not something to be terrified about, and the facial paralysis does tend to improve, as Dr. Sonia said, within 3 to 4 weeks. So it is something to know that, okay, if this happens, it's extremely rare. Only 1% of shingles cases are actually Ramsay Hunt syndrome, and it is usually treatable. So let's not panic, all right? Justin Bieber will be fine. I promise, I think.
The fans are going to be very happy to hear you say that Justin Bieber is going to be just fine. But Sonia, if you could also tell our viewers a few precautions that all of us can really take, because Justin Bieber is all of 28, please remember. And this is shocking at 28 to be diagnosed with facial paralysis. So what is the precaution that everyone, young, old, any age group, must take to avoid falling into this?
So, when we talk about facial paralysis, we're talking about isolated facial paralysis. Otherwise, facial paralysis, can be, there's another viral infection kind of a condition called Bell's palsy. That is something completely different. And then, of course, facial paralysis can happen with stroke, but usually that is accompanied by an arm weakness or a leg weakness, and that's a different kind of a facial paralysis. Which I don't want to confuse the viewers right now. We're going into the details of that, but main thing to know.
No, but it's good for the viewers to know what kind of paralysis exists, because one is this one where, as Kiran said, he's going to be just fine in the next couple of weeks, because there's not much to worry about, which is good news for all the fans listening in. But there are different kinds as well.
So in simple terms, so there's one which is called Bell's palsy. Again, that is the infection or inflammation of the facial nerve. And again, people have earpin, but they do not have a rash with it. That also takes its course of typically 4 weeks. And again, antivirals and steroids are used for treatment. But the biggest difference that people have to know is regarding a facial weakness from a stroke, which is a medical emergency. So usually with a facial weakness of a stroke, one way to differentiate is your forehead. You still will be able to move your forehead if it's a facial paralysis from a stroke. While in something like this, you will not. And that is very sudden, suddenly out of the blue, boom, you get this weakness. And along with that, you will have some arm or leg usually accompanied, even if not the leg. Usually there is arm involvement in a stroke. So just if there's a facial weakness that happens all of a sudden, along with your arm involvement, that could be a stroke, that's a medical emergency, get to the hospital right away. If you have a facial paralysis with a rash, that's likely shingles of the facial nerve or Ramsay Hunt syndrome, go to your doctor, they can give you the medication. If you have a facial weakness alone, along with maybe, a bad taste in your mouth and pain inside the ears, it could be Bell's palsy, again, get to your doctor and they can treat you. So I think that is the key, more common types of facial paralysis that we see. And again, although it's more common above the age of 60, the risk increases once people get above the age of 60. It can happen to anyone. And as we know, celebrities with they have a crazy lifestyle. I mean, they work really hard. Sleeping at odd hours. There's no fixed pattern of sleep. There's no fixed pattern of eating. And no matter how hard they try, especially when they're doing concerts, so that can definitely impact their stress levels. That can, lead to overall a lesser immunity.
That is actually most
prevent?
people in the banking industry, the news industry, the advertising industry, doctors and surgeons like you all. I mean, stress levels being high is something that really impacts everybody. Dr. Kiran, let's focus on the wellness aspect of it, because Justin says, my body really needs to slow down at this point of time. And with such high-strung environments that most celebrities work in, or most people who are in high-performance jobs work in as well, what is your advice to them?
He's absolutely correct. If you have that much stress that at this age you're struggling with a syndrome like this, it could absolutely mean that you're overstressed. And taking some time out for himself and protecting himself and resting and caring for himself, that's absolutely the right thing to do. This is the time to care for yourself. And he's, I believe, doing it absolutely correctly.
And how do you differentiate?
But it's quite impressive how he's been so open about it.
Yeah, but how do you differentiate, Dr. Kiran, when it's just a regular rash versus this kind of a rash which is very painful and it could lead to something of this nature? I know you've elaborated it, but once again, how do you really differentiate that? Because sometimes you go to a doctor and probably the doctor may not even realize that it's something much larger than what it appears to be.
So it's very key. It's a painful rash. See, most rashes are itchy or not itchy or whatever that is, but they're not painful. So a painful rash with shooting pain, severe pain, that's always something to check out. You always want to make sure it's not going to be a shingles. And anything with little vesicles like water-filled blisters, that's again something that we want to check out. So pain is a very big reason to go get yourself checked out right away so you can get the medication as soon as possible.
Dr. Sonia, are you seeing more youngsters getting facial paralysis and neurological disorders? Are they on the rise, including strokes as well in your practice? And in case the answer to that is yes, what is the factor that is causing all of this?
So, Jyoti, again, stroke is a completely different, entity. So, yes, we are seeing more younger people, I think, in general, have these conditions mainly because of lifestyle factors. When we think about stroke, the lifestyles of people are horrible. People are smoking, eating at odd hours, obesity is on the rise. So all of those, and physical activity not as much. So all these factors play a role in stroke. When it comes to facial paralysis, it's not as common. This is definitely a rare condition. It's not something we see, every day, but we do see it fairly, and even more than Ramsay Hunt. Ramsay Hunt is actually very rare, to see shingles really happening, affecting the facial nerve. We'll see probably Bell's palsy more than even Ramsay Hunt. So I think there's nothing to fear per se. I think the shocker for everyone is, why does a 28-year-old have it?
Yes.
I think what we just have to basically understand that, maybe we're not even aware of his underlying medical conditions, that might predispose him to it. That's one part of it. The other thing is that, yes, sometimes stress can lower the immunity. So maybe he was having, an episode where he's having a little bit of more lower immunity. And the key thing, what we have to know is, how do we enhance our immunity? And it again comes to good old things. Exercise regularly, eat healthy food, meditate, try to relax as much, we can do these things. We can lower our stress levels. We can make our body. It's
also very important to have a decent work-life balance, right? Would you categorize this merely as a neurological disorder or a lifestyle disorder as well?
No, this would be... Yeah, go ahead, sorry.
Go ahead, Kiran.
No, I was going to say, I think most disorders are very often lifestyle disorders, right? Because they're all triggered by, almost everything is triggered by stress. So yes, work-life balance is vital. We have to, working 20 hours a day is not going to help you. It's not going to long-term give you a healthy life. You end up with a lot more ramifications from it. So a healthy work-life balance, as Dr. Sonia said, sleeping, drinking water, meditating, finding ways to manage your stress, not allowing them to overtake you, good vitamins, good food, right? Good nourishing food, eating on time, taking your phone away from you after like 8 p.m., no screens, and just actually finding time to sit with yourself and do things that relax you. These are all vital things.
And
They're
we
all vital
often
things
forget
for
that.
living a
We
healthy,
often
long
forget
life.
all of those points that you just mentioned in this fast-paced, competitive world that we live in. Hang on right there, both of you. Let's now once again listen in to what the 28-year-old is going through. It's an eye-opener for the rest of us as well.
Hey everyone, Justin here. I wanted to update you guys on what's been going on. Obviously, as you can probably see from my face, I have this syndrome called Ramsay Hunt Syndrome, and it is from this virus that attacks the nerve in my ear and my facial nerves and has caused my face to have paralysis. As you can see, this eye is not blinking. I can't smile on this side of my face. This nostril will not move. So there's full paralysis in this side of my face. So for those who are frustrated by my cancellations of the next shows, I'm just physically, obviously not capable of doing them. This is pretty serious, as you can see.
Well, prima facie, Dr. Sonia's assessment here in Justin Bieber's case is there would be recovery in about 4 weeks' time, and she's seen multiple cases like that to know that. But Dr. Sonia, one big question, when anybody who's of that age or even older goes through something of that nature, are there any long-term consequences even after you recover?
Yeah, Chetty. So, most of the cases recover. That's the first thing. But there are some cases that may not recover fully. And that is always the biggest risk. We're hoping that with the medications that we're using, we're able to reduce the course and enhance the recovery, of the facial nerve. But the biggest long-term complication is actually incomplete recovery of the facial nerve. That is one big risk. In most of the people, it should get better, but there's always that small number of people where it is a problem. That's why it's good to do these facial exercises, because the more you activate your nerve, stronger are the chances, of getting that recovery. The other risk, of course, is if the eye gets affected, if people are not covering the eye in time, they can always end up getting, infection of the eye, infection of the cornea. That can again lead to, scary things like blindness. There's a possibility of hearing loss because, it affects the facial nerve, but it can also affect the nerve of the ear, which is actually very close to it. And then that can cause symptoms like hearing loss, ringing in the ears, things like that. So although the complications are very rare, it's just something to keep in mind, that this is a possibility. But usually most of the people, no panic, most of the people pretty much make a very good recovery.
Your words are very soothing when you say no panic, because everybody who's watching this is only thinking if he can get it, what about the rest of us as well? And he's absolutely somebody who looks visibly healthy, normal, highly performing celebrity, performs all over the world. Dr. Kiran, my last question before we let both of you go. Is this a root shock or is this an eye-opener?
I don't think it's a root shock. I think it's something that is rare, but we see it in medicine. It's something we treat. It's something we deal with. And it's, as Dr. Sonia says, there's nothing to panic about. Young people do get ill and young people do get better. Older people get ill and older people do get better. It's just something, it's a sign. It says, let's start taking care of ourselves. Let's stop borrowing from tomorrow to pay for today. Let's start living life in a healthy, more nourishing, more self-dedicated way. And that actually will be the best thing that anybody and everybody can actually take away from this.
And once more, before we let you go, Dr. Kiran, you mentioned that Justin Bieber will recover. Can we hear that from you once again? Because the fans would love to hear it from you.
Justin Bieber, I think you're going to be just fine. Okay?
That's good to hear. That's good to hear. Thank you so much, Dr. Kiran and Dr. Sonia, for joining us with your valuable inputs right there. With that, it's a wrap from me, Chaiti Narula, on this bulletin. For further news and updates, don't forget to log on to indiatoday.in or go ahead and download the India Today app. Thanks for watching. Thanks for your time.